Since we last started making really powerful vaccines for things that were really common in the world, we've come out with brand new molecular techniques that have been used in a lot of other things. So this idea of creating messenger RNA and giving it to people is actually already used in some cancer therapies and in some other things. And so in some other treatments, maybe neurologic and things like that. And so it's been tried. It's also been tried in vaccines that were less successful, which made people like me think, well, maybe it's not going to work very well for this vaccine either. But this is a completely different technique. It is vaccines 3.0. It can be done extremely quickly. So instead of having years of time to figure out how to grow a virus or bacteria properly and then how to inactivate it in a way that's safe, instead of having all of that run-up time, you just program in whatever protein you need, sort of using the recipe of the RNA that code, or the DNA and then RNA that codes for the protein that you want to make antibodies to. And you just plug it into this sort of system that we have of creating synthetic RNA, and then, which is actually the same as regular RNA, it's just made differently. And then you have to figure out a way to keep it stable inside the human body long enough to get into your cells. That's it. So the way these vaccines work is that messenger RNA recipe for the spike protein. That's that little piece that makes the crown on the coronavirus, the thing that sticks out and looks like a little umbrella or little spike on there. That spike protein is what most of our antibodies are to when we recover from infection. We are really focused on inactivating that spike protein, because that spike protein is what attaches to our cells and allows the virus to get in. So they take the recipe, the RNA recipe for that, and they create it. And then they inject it into us with some stabilizers. And that RNA is degraded actually in less than an hour after the dose is given. But in that hour, it does a lot of good. Your cells are programmed to translate, or transcribe in this case, RNA into proteins. So they take any recipe they get. Usually all the recipes are coming from the nucleus of the cell, and they're going to these little ribosomes where they are taking the RNA and they are turning it into a protein. They read the recipe, they throw everything in the right order, and then you end up with a protein. It takes this same messenger RNA that you've just gotten as your vaccine, and it just reads it just like it's anything else coming from the cell itself, and it makes you a spike protein. And that spike protein does what all spike proteins do. It just goes and floats to the outside of the membrane of the cell, and there it sits. Now, the body knows that this is not a normal protein, and your immune system recognizes it immediately as an invader. But it's just on one of your regular cells in your arm, just a regular cell, and it presents that antigen, that spike protein, to other cells that then activate the immune system. In short, if it was a cartoon, you might think of it as placing a giant wanted poster for coronavirus on the outside of your cell and advertising to the immune system that this is what's coming. You need to know this and recognize it right away. Your immune system gets to work and it starts creating not just antibodies, but also T-cell immunity and other things that are harder to get from other types of vaccines. And then you get a second dose, and that second dose is a whole lot like a training exercise. So, sometimes you learn how to do something like how to use a new software system, and then you do your first project with that software system, or you use it for the first day. You know how it's like a little bit rough, but by the end of that project, you understand how to use that software system way better than you did after just the first little training episode. That's what a booster of this vaccine does. It takes a small immune response that you get right after the first vaccine, and it says, okay, guys, I'm showing you the picture again, go at it. And it says, your immune system just wakes up and says, I got it. I know what to do. We saw this picture before. We need to react to it. It's like a fire drill for your body. And a bunch more proteins, like immune proteins, are made, a bunch more antibodies and a bunch more cytokines. And your body actually has a trial run at killing off COVID. That's what gets you to that peak immunity of 95% that they're showing in the trial. And that's why 2 doses really are very important. It's not just sort of random who's going to be immune after which dose. The point is that your immunity is durable and better and stronger, and your immune system is more ready after that second dose. So now you understand what messenger RNA vaccines are, why they can be made much more quickly, and why we need to have 2 doses.